4 early pregnancy signs before a missed period most women ignore. Have you ever felt different, but your period wasn't even late yet? Maybe you felt unusually tired. Maybe your breasts felt sore. Maybe you just knew something was off. But the pregnancy test said negative. Here's the truth most people don't know. Your body can start showing signs of pregnancy before you miss your period. And some of those signs are so subtle, women mistake them for PMs. Today, I'm breaking down the real early signs, the ones most women ignore. And one of them, almost no one talks about it. 1. Unusual fatigue. This is not normal tired. Describe: heavy eyelids, sudden exhaustion needing naps, progesterone rise. You slept 8 hours and still feel like you ran a marathon? Does that sound familiar? 2. Nausea before missed period mythbreaker. Morning sickness doesn't always wait. Hormones, metallic taste, food aversions, increased saliva. Some women notice they suddenly hate foods they loved last week. 3. Breast changes, heavier feeling, tingling, darker, areolas. And there's one small detail many women notice in the mirror. Sing 4. Implantation bleeding, the ignored one. This is your viral moment. Light spotting that looks like the start of a period but stops. Many women think their period came early and never test. When should you test? Now let's talk about one of the biggest questions. When is the right time to take a pregnancy test? The most reliable time to take a home pregnancy test is after you have missed your period. By that time, the hormone HCG has usually risen high enough to be detected in urine. Some early detection tests claim they can work a few days before a missed period, and sometimes they do. But testing too early often leads to a negative result, even if you are pregnant. Here's why. After implantation, HCG begins to rise gradually. In the very beginning, the amount of HCG in your body is extremely low. It typically doubles every 48 to 72 hours in early pregnancy. If you test before the hormone has built up enough, the test may not detect it. This is called a false negative. It doesn't mean you're not pregnant. It may simply mean it's too soon. That's why waiting even 2 or 3 extra days can make a big difference, and it can prevent unnecessary stress, because testing too early often causes anxiety. Now, let's talk about blood tests versus urine tests. Home pregnancy tests use urine to detect HCG. They are convenient and private, but they require the hormone level to reach a certain threshold before turning positive. Blood tests done at a clinic can detect much smaller amounts of HCG. This means a blood test can confirm pregnancy earlier than a urine test. There are 2 types of blood tests. A qualitative test, which simply confirms whether HCG is present, and a quantitative test, which measures the exact level of HCG in the blood. Quantitative tests can also help healthcare providers monitor how a pregnancy is progressing in the early weeks. If you suspect pregnancy but keep getting negative home tests, speaking to a healthcare provider about a blood test may provide clarity. Most importantly, be patient with your body. Hormones rise in their own time. Waiting a few extra days before testing can give you a more accurate answer and much more peace of mind. This content is for educational purposes only and does not replace medical advice. Please consult a healthcare professional for personal medical concerns, whether you're hoping to be pregnant or hoping not to be. Your body whispers before it screams. Listen to it. If you noticed several of these signs, wait a few days and test again. Comment below which sign surprised you most.